Hello, I'm Dr. Vail Garvin, President and CEO of the Central Bucks Chamber of Commerce. Welcome to another Chamber Chat. We are thrilled and honored today to have with us Dr. Damsker, who's in charge of the Bucks County Health Department. Thank you, sir, for taking the time to be with us. And I just want to thank you and the Bucks County Commissioners for everything you've been doing to help keep us safe. So, talk to me about what you think is going to happen to Bucks County going forward.
Sure. I think that the universal masking order that Governor Wolf recently put into place will be in effect
I have
for.
my mask.
It's good. I have
I have my
mask.
thumb.
I have a gaiter. I have a face shield. I'm trying all different things. But I think we should all get used to the fact that when schools start again, the kids will be wearing masks. We will be seeing these for the foreseeable future. I
Okay.
think in a lot of ways it's a good thing. Bucks County had a large surge earlier on in the epidemic, and what that did was that made Pennsylvania and New York City and New York sort of take it real seriously.
Right.
And some of the states that didn't have that initial spike, maybe they didn't realize that if they didn't continue to do things, that they would have their own surges, and that's what's happening in many states across the country. Clearly here in Bucks County and around in the state of Pennsylvania, the governor, as I mentioned earlier, put in that universal masking order, and that's a pretty strong thing to do. And I think that we know that masks do prevent spread from sick people. If you're coughing or sneezing, if you're out and about, it does keep the virus inside of the masks, from being out. People who wear masks, it also can be protective. It's not just wearing a mask to protect others, but wearing a mask can protect you or a face shield from droplets that if someone coughs or sneezes and you're wearing a face shield,
Do you
it
mind
goes
if I
against.
ask you something?
Yeah.
How long do the droplets stay in the air? And if I go onto an elevator that somebody who's been sick is on the elevator, how long does it stay in the air? I've been asked that question.
Sure. And there's the WHO and the CDC. There's been a little bit of a different feeling for how common this occurrence is. Airborne spread traditionally has been with things like chickenpox, measles, where you have to basically, if you have someone with measles in your exam room as a physician, you're supposed to wait 2 hours to put anyone else in there.
How about that?
But with coronavirus, it's not to say that it can't happen, and I'm sure there's been situations where there's small particles, but if that was truly the case, we'd have attack rates that were extremely high, much higher than what we're seeing in many households. If someone knows they have coronavirus in a household and they do most common sense things, they're able to prevent the spread to anyone else in the household. Like if I say, Dr. Garvin, you have coronavirus and you live with your husband and your kids, if you make a pretty good faith effort to stay to yourself and to wash the refrigerator handle off after you use it and all those kinds of things, we see those households don't have a lot of spread. And with something like measles, chickenpox, where it's truly airborne, the masks that we're wearing don't really help anyway. The airborne particles, you have to wear an N95 mask that prevents most particles.
Right.
So if these were truly airborne diseases in long situations, we'd all have to be wearing N95s, which clearly isn't going to be the case. And these surgical masks and face shields and other things do prevent the spread of this. So that would indicate that it's most likely a droplet spread. And when you
Okay.
cough or talk and sneeze, most of the gravity brings these large droplets down 3 feet is where a lot of them come down. And yes, there's a few more that may hang around up to 6 feet. And that's where the CDC sort of gets the 6 feet number from.
Okay.
And 3 feet is used around the world in a lot of other countries. But so the majority of droplets do tend to go down within 3 feet. And 6 feet's better, 9 feet's better, 12 feet's better. If you not in the same room with anybody else, you're pretty likely not to get coronavirus. But the point is that what we have in place now with masking universally and maintaining, a social distance, that works in almost every situation, which tells us that it's more droplet spread, not airborne.
How long does it stay on the ground? Like if I'm walking along and get it on the bottom of my shoes.
Yeah, and that's that. Again, that we're not seeing spread that way. I
Okay.
can't. I
All
couldn't
right.
tell you that it's impossible.
Right.
But
That's good
that's
to
why
know.
we also tell people to wipe surfaces down. Right now I'm talking. If I had coronavirus, if I coughed or sneezed
Right.
and some droplets went on this table, they're potentially infectious. And the CDC says they're not sure how infectious, but we've had a couple of cases here in Bucks County where someone didn't interact with anybody other than going to a gas pump. touched the gas pump,
How
and went
about
back,
that?
to their house, never left the
Yes.
house for any other reason. So there is a chance that you can get, it's called fomite spread, when you touch a surface that was contaminated. We don't know how common that is or or whether, what percent of the cases are transmitted that way, but I'm pretty confident that with that and influenza and other things, that surfaces can transmit disease. And that's why we always talk about sanitizing, carry hand sanitizer with you in your car,
Right.
and constantly, thinking about washing your hands. It doesn't mean you have to wash your hands every 5 seconds.
Right.
It just means that when you're out in public and you're touching things, just be cognizant not to touch your eyes, your nose, and your mouth, before you've had a chance to at least sanitize.
Do you think Bucks County has stabilized out now, or do you see a rise, or where are we?
Yeah, right now we're in an interesting zone. We have stabilized for the most part, from infections that people got in Bucks County. We are seeing a rise though of people that have gotten infected in other locations. So people are still traveling. It's the summer, right? So people are off from work. They're going to Florida. They're going to Arizona.
The Jersey Shore.
The Jersey Shore. And the Jersey Shore, we have seen infections from the Jersey Shore. So even though it's not one of the states you're supposed to quarantine from, I'm not even saying we have to make everyone stay at home for 14 days. What we recommend for people that are traveling is more of a modified version of that. We're saying when you go to those states that are on the list that have high prevalence, be real careful. Wear your mask, sanitize. Don't go to crowded bars. Don't go anywhere to any gathering where people aren't wearing masks. Be smart, be safe, just like you wouldn't do here.
Right.
And then when you come back for that 10 or 14 days, when you come back, be careful, right? Wear your mask all the time when you go to work. Don't go.
So
visit.
they don't have to stay at home and quarantine in-house for 14 days if they've been to Florida.
Correct. I mean, the governor recommends that they do that, and
Okay.
what we're saying though is, especially if you have an essential job, right? If you can work from home, if you have the kind of job where it doesn't matter if you go, then sure, we recommend stay at home if you can. But there's a lot of people out there that are essential workers,
Right.
that would have difficulty not going to work. If you're a doctor, if you're whatever
Right.
the situation is, even teachers. We're recommending that you go back to school or we go back to whatever when this happens, and you can't take your mask off at any point. If you want to eat your lunch, you eat your lunch separate from everybody else. But we know that masking is an effective barrier for droplet spread.
Okay.
So we're saying that you just be extra careful. Maybe you don't go visit your 90-year-old mother, for that first several days that you're back from those states. And I think if everyone follows those common sense things, because the problem is, that list of states could grow. And you can't go anywhere. Then what if a different county is a higher risk? So you're saying you can't go to Montgomery County? There's a lot of
Right.
common sense things that we're looking at to say, hey, you can still be careful and still be pragmatic at the same time.
What other thoughts do you have that you could give to our businesses? Restaurants now, people can eat in the restaurants 50%, correct?
Yes.
What other guidance do you have? I see the different towns trying to adjust with closing down certain streets so that people can eat out in the streets. Any guidance?
Yeah, obviously eating outside is probably safer. Just being outside in general, with any virus, whether it's influenza, whether it's measles, anything, when you're outside, the transmission goes way down. And we know that scientifically that's the case. So some restaurants don't have that ability, right? They don't have a place where they can eat outside. So they need to be real careful. Make sure you separate the tables out. I know it's difficult for restaurants. They've been sort of, vilified with gyms and hair salons. Yeah. But at the same time, if there's outbreaks in those facilities, and there have been around the country, people in bars, I can't emphasize enough that if you have a restaurant that has a bar in it, or you are a bar owner, follow the guidelines, because if there are outbreaks seen, the first place the governor will shut down will be those facilities.
Right.
So if he sees an outbreak from many gyms or from whatever the particular business is where Governor Wolf sees outbreaks in, he will be more likely to take targeted effect. I don't believe he's going to go back to a full stay-at-home order. I think that was sort of a one-time thing. I'm not sure that'll ever be possible again. But universal masking is a pretty strong order, and I think that'll have a good impact. I think the CDC just recommended full masking nationwide, and I think you'll start to see that will help with our numbers.
Okay.
It'll take a few weeks, but that will help. But businesses, again, bars. What you don't want to have happen is people drinking, and then the frontal lobe is affected. When you have a couple of beers, a couple of drinks,
Right.
you start to forget about social distancing and you start sharing drinks and doing things you would never do when you're completely sober, not having a good time. And we're not telling people they can't have a little alcohol, enjoy the summer, have a beer. But the point is, when you're doing that, be social distance. Don't stand up. The bar shouldn't serve you if you're standing up. We don't want people crowding shoulder to shoulder at bars.
Okay.
We want people sitting down at the bar. Your party should be social distance from other parties. Keep the parties of 4 or less. And again, this wasn't put out just to penalize anybody. This is put out because we had outbreaks here in Bucks County related to bars and restaurants prior to the shutdown.
Is that right?
We did, and there's other places around this country that are currently having that. That's why other states have shut down alcohol service in bars. Even Allegheny County, here in Pennsylvania, shut down alcohol service in bars because they were having outbreaks. And we're also seeing younger people now that are the trend is now we're seeing 20s, 30s people that are getting infected. And I believe that they're having gatherings. They may not even be at a restaurant. 4th of July parties.
Probably on the beach.
On the beach, but there's people that had 4th of July parties over the last, couple of weeks. We've seen a couple of cases from that where people are just showing up at parties thinking, well, it's not at a restaurant, so we'll just hang out at someone's house and not pay any attention to what we're doing. And we want to let people know that you can get infected at someone's house that you're friends with just as easily as you can at a bar or a restaurant or anywhere else if you're not being careful. So we recommend to everyone, take it seriously wherever you are. If you're with people outside of your household, social distance. If you don't want to wear a mask, fine. Sit apart from them. Social distance. You can still have a conversation 6 feet apart.
Like we're having
like
now.
We're having right now. So I want people to know that, things are not going to get better if everyone just goes back to doing what they were doing. I'm not saying that I'm totally not in favor of shutdowns. I think people need to be responsible, though, and say we all have to do this together. As I said earlier, wearing a mask for a long period of time is not comfortable. I hear people when they say that. You walk around, you see people on a hot day, they pull their mask down sometimes. Take a break. If you feel like it's getting to be too much, step away from everybody else, pull your mask down, take a few minute break, check your email, whatever, and be smart about it, and then go back to work with the mask on. And you're allowed to take breaks. I think that's really important because there's a lot of jobs that are now saying you have to wear a mask the entire shift. And these are people that have never worn one before. These aren't all doctors and nurses that are used to wearing them. And I think it's really important that employers say to people, we need you to wear these, but we also need you to take breaks and give them a chance to step away for a little while, get their thoughts together, feel better, and then go back to work wearing the mask. And I think that we need to just get used to it because this is not going away. We will be probably under this universal masking order until the vaccine comes out, or the virus magically goes away, which I don't see happening in the foreseeable future.
That leads me to 2 questions. Do you see another wave coming during flu season, December, January, February?
It all depends. If this universal masking order stays in place, I think we can avoid a wave. The states that were having these surges weren't doing a universal masking order. Like now they're trying to sort of work those in. And I think that the whole country just has to get used to this idea of just being smart and responsible. And once we do that, we can avoid it. We may not even have much of a flu season, to be honest. The same things we're doing now to prevent coronavirus as droplets spread are the same things that we do to prevent flu.
Good point.
Every year I tell people, wash your hands and all those things. No one pays attention.
Right.
We have a flu season every year because no one is paying attention to the normal hygiene that we always want people to do.
Huh.
So this will be a really interesting practical epidemiology situation where for the first time we're going to have an upcoming flu season where everyone's masking, everyone's washing their hands, everyone's social distancing. We've never had that before. So it'll be interesting to see if we even have much of a flu season at all. I predict if we maintain these types of things, we're going to have a very minor flu season this year.
That's good to hear. That'll help the hospitals out.
Absolutely.
How are our hospitals in Bucks County doing? I mean,
right now they're doing very well.
Good.
We have the lowest number of hospitalizations and people on ventilators that we've had since, mid-March when the whole thing started. So we had a really big spike, and we came back down, and now we're just hope that it keeps that way. I mean, in reality, the numbers of cases themselves isn't as big a deal as how many people are hospitalized, right? If everyone gets coronavirus in the whole country and no one goes in the hospital and dies from it, who cares, right? Who cares how many cases there are? What matters is that we protect the people that are most at risk, which are the people in nursing homes. Mm-hmm. We still take everyone's temperature. We're still not even allowing visitation in nursing homes that have any cases. So we're taking that real seriously because those were the deaths. I mean, we had we've had 560 deaths or so in Bucks County, and 90+% were in nursing homes.
Is that right?
Yeah, those people are at the highest risk of dying.
Right.
These are people who are very fragile. These people,
Right.
a lot of, we have, for instance, at the Neshaminy Manor Nursing Home, with which the county runs, we have 20 deaths a month, on a regular month, without coronavirus. So these are very fragile people. And coronavirus, unfortunately, can be that one last step that puts
Right. people
over the edge. And it's very unfortunate. And we had a lot of deaths, hundreds of deaths here in Bucks County. But if you say to people who's gotten infected that are not in nursing homes, the mortality rate is much, much lower.
That's
The
good to
illness is much, much lower. So we need to keep protecting those that are in nursing homes and those kinds of facilities. But when the virus gets out of that age group, out of that population, it is definitely less, from mortality, from a hospitalization perspective. Now, it doesn't mean people aren't going to be hospitalized.
Right.
It doesn't mean that someone who's healthy isn't going to die at some point, because it has happened. There have been deaths in the United States of people that are relatively healthy. So no one can say that doesn't happen, but at the same time, that does happen with flu. Perfectly healthy people have died from influenza. And in a normal year, nobody bats an eye, unless it's someone you know. And I think that we need to all get used to the fact that these cases are here to stay. This baseline that we have in Bucks County isn't going to just magically go away on its own. As long as we have stores open, and even during the shutdown, Lowe's was open, hospitals were open, grocery stores were open. We always had cases because you can't shut those things down ever.
Right.
You can never, ever have a full shutdown. It doesn't work. People will starve. Some people just eat, they need food, right? You can't shut down every place to get food and medical supplies, so you're always going to have a baseline of transmission. So you're never going to totally snuff out coronavirus. So let's keep everything open as much as possible, being safe.
Right.
I'm a proponent of opening schools in
I was
person.
just going to ask
Yes.
you about that.
I'm a proponent of opening schools safely.
Okay.
I think the universal masking order, which is in place now, is very helpful. I think the school is going to do their best to offer a minimum of 3 feet and close to 6 feet as possible. Other schools in Europe, many countries, they started off with masking and lots of feet, and they've come down to realize that if you're smart, 3 feet does work with masking, and I think we can do that here. I think there's a lot of parents that are concerned. I think most of the schools are probably going to offer a sort of a virtual option for those parents that don't want to send their kids back, and that's understandable. But as we've talked about, in other situations, that keeping kids at home permanently has it's a large issue for the kids. Number one, they're not learning as well in person. I think everyone realizes that in-person teaching is the best. There's social educational development, all kinds of things that just isn't happening when the kids are at home. We've seen depression, we've seen child abuse, all kinds of things that happen more often when the kids are at home. They're locked in with their abusers in many situations. So I think that reopening schools can be done safely. I think that businesses can remain open, but we have to realize that masking is not going anywhere. And if someone doesn't feel comfortable, there's other options. As I said, there's face shields. There are more comfortable different types of masks. There's gaiters you can wear. There's all kinds of things that you can do. You can try different things. I recommend that people.
So the face shields are just as effective as the masks.
The face shields for droplet spread are, and the governor has said that really any material that fully covers that your nose and your mouth is acceptable. You can cut a T-shirt and make it, with little hair bands and whatever you want to wear. But that's what the governor requires, and those do prevent droplet spread.
Got it.
And I want people to try different things out. I've been wearing a face shield at times, and I find that to be pretty comfortable.
Yeah, you can breathe much more easily.
Exactly. So there's people that say I'm claustrophobic, I can't wear a mask. Try a face shield. Order them on Amazon. You can buy them. They're available, and we're actually going to try, if we can, to provide face shields for a lot of the students in the schools. The county's going to try to purchase face shields.
Okay.
And I think that will be helpful in a school setting where the teachers can see the kids' faces. It's very difficult. I've been in meetings where everyone's wearing masks, and I have difficulty understanding what they're saying to me.
And you can't see their smile.
Correct. I can't tell if someone's...
You can see it here, but not...
Right. I mean, I can't tell if someone's angry with me or happy with me when I'm talking to them, or sticking their tongue out at me, because you can't tell. And wearing a face shield allows for expression. You can hear them better. And if you're a teacher in a classroom, if you're looking at 20 kids in a classroom and you can't see, because usually you can see on some kid's face, if little Johnny, you're doing a math problem, and he has this puzzled look on his face, you can't tell that. So I think that face shields will have a large role in schools. They can have a large role in our businesses too. If there's a waiter or a waitress in a restaurant that just can't wear that mask, put a face shield on. And they'll find that wearing those for extended periods of time is easier for a lot of people. Some people prefer
And
masks.
then what? You wipe it down afterwards.
Correct. All you
with
need is an alcohol
Purell.
wipe, or anything
alcohol
anything you can. Yes, alcohol wipes work really well. Get a little alcohol wipe,
Yeah.
wipe the front and the back,
Okay.
and do that every day, or whatever gets contaminated, and that's all you have to
I
do.
have to get a face shield.
Yeah, I would emphasize everyone, if you have trouble wearing a mask,
All right.
try a face shield, and you'll see a difference.
Is there anything else before we close out that you could say to us, to our businesses, that we could take with us? I really appreciate you spending this time with me.
Sure, I would say the businesses try your best to comply with the orders. I know some of them seem overbearing. They don't make a lot of sense, but the governor has those orders in place because he doesn't want to have a shutdown again. I don't believe the governor wants to shut anything down again. Our business is the lifeblood of Bucks County. If businesses don't open, parents have nowhere to work, and there's a whole trickle down effect. If people don't have jobs, there's no economy. So I think businesses need to do as much as they can, to follow those guidelines. I think, and most are. We get. There's always, if someone walks in your store and pulls their mask down, you have to always be smart about it. It's not worth it to have a physical confrontation
Right.
with someone who comes in your store, but at the same time, you make sure your employees are following. Make sure you're following the guidelines. We deal with
You
bars
want to
and
keep your
restaurants.
employees safe as well as
Exactly.
the customers safe.
Because the last thing you don't have an outbreak amongst your own employees.
Right.
That causes problems. So all these guidelines are in place, so we don't have another shutdown. And we're hoping that over time, we want people to stick with it. I know it's hard. Businesses were shut down. People weren't making the same amount of money they were making. This is not easy, and I don't think anyone would argue with me on that. But the problem is if we go back to just going back to totally back to normal, and you see what's happening in states where you just do that, then we have all these cases. The governor's going to implement potentially new restrictions that are worse than what we have now, and that's not good for anybody either. So I want the businesses to do their best they can to follow the rule. Making a good faith effort makes a difference, right? And you can't follow every guideline every time, every 5
Right.
minutes. But if most people are following most of the guidelines, that has a really large effect, and will keep Bucks County, our cases low.
Well, thank you so much for spending the time with us and with the business community. I want to thank Dr. Damsker. I also want to take this opportunity to thank Tom Brunt, who's our videographer and who does such a great job helping us do Chamber Chat on the street. Once again, I'm Vail Garvin, Central Bucks Chamber of Commerce. Thank you for joining us. Bye.